So I am going to go ahead and get us started with introductions. So our panelists this morning include Vikki Crouse, my colleague here at NC Child, who serves, among many things, as the NC Kids Count Project Director. The Kids Count Project is under the Annie Casey Foundation and provides a premium source of data across all 50 states for children and family-specific data measures. So we're so happy to have Vikki with us this morning. We are also joined by Elizabeth Miller, who is the CEO of the Parenting Path, an organization committed to preventing and treating child abuse and neglect through supporting families and communities through core services and helping to influence policy that impacts these individuals' lives. So we will go ahead and get started with our presentation this morning. And again, if you have any questions at all, please feel free to add them into our Q&A box.
Good morning, everyone. My name is Vikki Crouse, and thank you all so much for joining us for this session, Dismantling Racism with Data. Thank you to our moderator for introducing me and the other speaker today. So let's go ahead and jump into the presentation. So we can go on to the next slide. So to start us off, I want to talk about what's ahead for this session. And so first, we're going to tackle the key question, which is, why is data a key tool for effective advocacy? If dismantling racism, systemic racism, is where we want to go, how is it that data can get us there? Second, how exactly can we use data to change minds and policies? I'll share 3 tips for how you can get started or how you can keep growing in your data journey. And finally, I'll be sharing a video clip of a really good interview I had with Elizabeth Miller, who is the CEO of the Parenting Path, who participated in last year's Dismantling Racism with Data learning series. She and I spoke about some of her team's takeaways from the learning series and how her team is working to apply those lessons today. We can go on to the next slide. So I know this session is pre-recorded, but I'll be joining you live in the chat the day of the event. So I'd love to hear from you all in the chat now. How does your agency currently use data? And your responses really help us get an idea of where you are at with your data work, right? Are you using it mostly for internal purposes? Are you sharing data publicly with your stakeholders? So take a few seconds to write that in the chat. Perhaps you're using data to write grant reports, or design your programs internally and strengthen them based on what's worked in the past. Perhaps you share data, as I shared, with external stakeholders like community members or policymakers. But right off the bat, we know that data is important for the work that we do, right? Thank you all so much for sharing how you're using data. All right, let's go on to the next slide. So we know that reliable data is the backbone of any effective advocacy work because it helps us not only define the scope of a problem, but also any potential solutions. At its core, data is simply a collection of facts. That's all it is. And when we take the time to study those facts, we can make informed decisions to drive our strategies and get us to where we want to go. And that's because data helps us be able to identify patterns. It also helps us make informed predictions about what will happen in the future based on what's happened in the past. And it helps us be able to spot things that are unusual in our data based on what we've seen happen in the past. And if we break it down further, and we can go on to the next transition, we know that data are numbers, and the next transition, data are also stories. So what we refer to as quantitative and qualitative data. And so quantitative data is about facts that are specific and numerical. And these often help tell us the what, the how many, and the how often about a problem. Thank you. And we can go on to the next slide. And so what comes to mind for me is our county data cards, which provide local data at a glance. If you've ever had a chance to look through NC Child's data cards, we release them annually every spring. And these data cards, we group 15 indicators on children and families across 5 areas of well-being. And we can see different measures of how kids are doing. The percentage of households that are food insecure, the median family income in a given county, among others. But you'll note that what's missing from this snapshot of one of our data cards is a context, right? And that's where qualitative data really shines. So we can go on to the next slide. So qualitative data or descriptive data describes qualities and characteristics that can't be measured with numbers. This type of data gives us important context to those numbers. It often gives us the why about a problem. Rather than expect the data to just tell us what is happening, we have to dig deep to point to some of the reasons behind why it's happening. And this is the data that helps us do just that. All right, we can go on to the next slide. And so a good example of stories as data is the Early Well Initiative's recent project to understand what was happening with our social emotional health ecosystem in North Carolina. I hope you've had a chance to dig into this report. If not, you can find it at the link on the slide. It's a really great report. And a team of community-based organizations interviewed and surveyed more than 200 North Carolina families from 28 different counties across the state for this project. And what these stories helped bring to light were some of the barriers that families face to accessing important services. These stories help us understand the why behind the numbers. For example, the why behind low enrollment rates in certain programs, among others. So stories are powerful data. And you'll note the tie to the theme for our event, right? It's that prioritizing data directly from our communities and lifting that information up helps us achieve community-driven change. So that is very key. Next slide. But if data is a tool for effective advocacy, we also have to consider the question about whether data is even fair. Now, is data always fair? Is data always objective? By definition, numerical data is objective information. But so often what we overlook is that there can be plenty of biases in our data and in how we represent our data. And that leads to biased decisions. For example, sometimes we make decisions with incomplete data. And throughout history, that's sometimes been an intentional decision to leave out certain subpopulations from a data set or simply ignore them and make decisions that have large consequences based on incomplete data. And so a big piece of this work is simply being aware of what biases exist in data, noting what data is missing that may sometimes maybe out of our control, right? We can't always control what data is collected by state agencies or local agencies, and making sure that we're not perpetuating those biases in our work. And so we want to make our data and our data communications as inclusive as possible with the resources that are available to us. So how do we even begin to do that? We can go on to the next slide. Well, Stanford professor Dr. Andy Krakow said this: raw data is like an iron ore. You have to turn it into a tool. For data to become action and not mere information, it must be presented in a way that makes it clear what is wrong and what we can do about it. So I'll repeat that. In order for data to become action and not just be mere information, it has to be presented in a way that makes it clear what is wrong and what we can do about it. So the first step to achieving this is to present an accurate and whole picture of what is happening. And we can't do this without showing the disaggregated data to represent the full picture of what is happening. So tip number one, as you can see on the screen, is that disaggregated data is a foundation for equity. Next slide. We know that data from large populations can mask some variations in child well-being. And that's because the well-being of children depends on the well-being of their families and their communities, including the county, the city, and the neighborhood in which the child is born and raised. Access and outcomes for children from smaller rural counties can be very different than for children born in larger metropolitan counties, right? And so it's important to talk about those differences when we present our data. So that's why it's important to disaggregate data when possible. Even with the best equipped counties, there are often large disparities between children of different income levels and races. So we can't tell the whole story of a community's needs if we aren't paying attention to some of those characteristics. Because we know from the research on this that race, ethnicity, income level, zip code, etc., are things that can predict outcomes for kids. And that's in part due to things like systemic racism, systemic barriers to economic mobility, etc. So that's why it's important to pay attention to those differences and to lift them up whenever that data is possible. Next slide. So let's take a look at another example. When we look at poverty among households with children, we know that nearly half or 45% of children live in poor or low income homes in our state. And although 45% is unacceptable, the data tells a much more focused story broken down by race, or when we break it down by race. And so Black, American Indian, and Hispanic children are more likely than white and API children to experience poverty. We can see here that there is a pattern of poverty in our state that is giving us disproportionately negative results for Black, American Indian, and Hispanic children. We'll come back to this indicator about poverty in a moment. Next slide. If you decide to present data disaggregated by race and ethnicity, one thing to pay special attention to is your data labels. If you're pulling data from another source, you'll want to know whether you can combine certain categories together. For example, present multiple racial and ethnic categories in a bar graph, and make sure that you're not double counting certain population groups. And what we mean by that is, for example, one of the most common ways that this shows up is with Hispanic people or Latinx people. Most data sources use the term Hispanic to refer to this group. And so for the purposes of not confusing you all, that's the term that I'm going to use today. So data sources tend to separate Hispanic people from racial groups because, as you all know, when we're talking about Hispanic, we're referring to an ethnicity and not a racial group. So we know there's a lot of racial diversity as among Hispanic people. There are Hispanic people who identify as racially Black or racially white, as well as mestizo, which refers to descendants of indigenous people and European colonizers. And so some Hispanic people prefer to mark themselves as some other race, for example, on the census. Because of that, you'll see data sources that refer to white, non-Hispanic, or Black, non-Hispanic, because they're separating out Hispanic people who don't identify as those races and putting them in a separate ethnicity category, right? Because then they'll separately report out the Hispanic category. So if you don't see these labels that are making that distinction, you might be double counting Hispanic people because they might not be separated out of those racial categories. And all right, and we can go on to the next slide. Another thing I want to note is that a lot of you may be very interested in sharing or using local data in your work. And as I shared earlier, when we're disaggregating data by race and ethnicity, which is very important to try to do, we help to tell a fuller story about what's happening in our community. Unfortunately, the other side of the coin is that we're also working with smaller sample sizes. So we do want to pay attention that we're doing some of the following when we're sharing local data or data with small sample sizes. It's good to present local data with a note to use caution when interpreting the data because with smaller sample sizes, there can be a larger margin of error. You're using a small sample to describe a much bigger population, right? Because if I ask 3 people whether cats or dogs are better and they all say cats, I can't then say that 100% of all people in Wake County think cats are better. There's a large margin of error there. So you may choose to aggregate your data, meaning you calculate an average of the data across several years in order to increase your sample size, right? Because we're not just talking about, all the cat lovers in Wake County in the year 2020. We're now aggregating them over the last 5 years. So we're working with a much larger sample. The downside, of course, is that it won't be the most current data because it'll include data from previous years. But in data, we say that precision is more important than currency. So it's better to show more reliable data. We often see data disaggregated, as I mentioned, over 5 years. That can be considered the most reliable, particularly if you're pulling data from our Kids Count profile. You might see that some of our data is a 5-year estimate, and so that's what it's referring to. If you're working with raw local data, you might choose to suppress, meaning exclude certain estimates due to the small sample size. For us, we might choose to exclude counties that have a count less than 10 or 5. Sometimes the state agency where we get data might tell us that they think we should suppress certain estimates. So that's an option too. It's just to take their direction or their advice on suppression. All right, next slide. So now let's turn to tip number 2. We have to consider how outcomes may be linked. And this is really important for weaving together your story with data. Next slide. One data point can lead you to consider another, which may have bigger implications for policy and practice change. So you'll remember we were looking at poverty among households with children, poor low-income homes. And so continuing with that example, consider now some data on parental employment. Black and Hispanic parents are more likely than API and white parents to lack full-time year-round employment. You can see that from the bar graph here. Next slide. And then again, with households with children, looking at median household income, we see that API and white households have more than twice the income of Black and Hispanic or Latino households. So now we can see a fuller picture of family circumstances that points us towards the information we need to be seeking out and sharing about the why, continuing to use our example, Black and Hispanic parents are less likely to be working full-time and have high wages in North Carolina, and subsequently why their children are more likely to be living in poor and low-income homes. And we know there are other factors at play, but you can see here from this example how we might link together different indicators to see the ties and connections between each, and that can point us to what sort of solutions we should be looking towards, right? If employment, low wages, those are some of the things we might consider when we're crafting or thinking about policy solutions. And current and historical policy choices can answer this, right? When we start to understand what might be the root cause of certain issues that we see in the data. And that leads us to our final point. So we can go on to the next slide. Tip number 3 is that we don't let numerical data stand alone. And there are 2 reasons for this. First, data is most effective at driving change when it can speak both to the head and the heart. Secondly, numerical data without context can take on any meaning someone might ascribe. And so again, what we're referring to here is the qualitative data that is really key, those powerful stories that give us context. Next slide. Here's a quote from Paul Slovic that says, numerical representations of human lives do not necessarily convey the importance of those lives. All too often, the numbers represent dry statistics, human beings with the tears dried off. And so your strength as advocates really lies in your lived experience. So don't be afraid to share it when you're talking about numbers, because that, as we shared, is also data. And that is something that numbers alone can't convey. Quotes and personal stories appeal to people, and they are often what is remembered, even if the numbers are not. Next slide. So using pictures and call out quotes and information boxes and personal experiences in the way that you present your data helps people understand important points, but also, and importantly, the human value called forth in your advocacy. And these are all ways to clarify additional points and also make it plain that your data work is more than just work about numbers. It's work about people. Ultimately, data is a tool, and if you use it well, it helps you to tell stories, which change the minds and hearts behind policy. And that is how we can change outcomes for kids. Next slide. Elaine Mejia from the Center on Budget and Policy Priorities offers some really great advice on the topic of not letting data stand alone. She says, don't put out bare facts about race that you're packaging within values or goals or visions. A bare statistic about a race or ethnic group can inadvertently reinforce negative biases that the audience may hold about that group. In essence, we're letting the audience fill in the blank, right? So instead of saying 40% of Hispanic kids are poor, you can start with opportunity is still out of reach for many families, 40% of Hispanic children, etc. So providing that context is key. You know, language is the way that we explain and reinforce our beliefs and values. It can foster or reinforce equity or inequity depending on how we use it. Similarly, it's important to consider our data visualization, our graphs, our infographics, and make sure that we're not reinforcing otherizing language or accidentally reinforcing racial stereotypes with those. So for example, using things that imply collective group-wide weaknesses that don't actually reveal the structural reasons behind certain numbers. So blanket terms like vulnerable or disadvantaged, it might help you to map out these terms and how we're using them, and then working to move beyond them. Or at least when we do use them, always pairing them with a structural explanation that gets to the why. Otherwise, we're labeling an entire group as somehow being inherently different, and we're reinforcing harmful narratives. Next slide. So it's important to use people first language and to define people as their aspirations and contributions and not by challenges or deficits. Asset framing primes us to hear associations of worth. It makes us less likely to stereotype people as a problem and more likely to consider systemic obstacles. We also want to move away from only talking about race and people of color when we're talking about the problem. That inadvertently can have the effect of making communities of color seem like the problem. So also talk about race when you're talking about your vision of what could be if we radically invested in communities and dismantle barriers that communities face. So moving from how much is not there or how much is lacking to how much is already here and how much could be there. Next slide. So let's recap our recommendations from today. Disaggregated data is a foundation for equity. It helps us present an accurate picture of what's going on. Consider how outcomes may be linked. Doing so helps us move away from explaining the what about a problem and instead telling the why about a problem to move people to action. And don't let numerical data stand alone. Data is most effective at driving change when it can speak to both the head and the heart. So combining the numbers with the stories. Next slide. All right, so now that you have those 3 tips in your pocket, you might be curious to know what happens when you begin to put those steps into practice. So I'm excited to share an example from community practice from the Parenting Path. Elizabeth Miller, who is the CEO of Parenting Path, shared with me her team's biggest takeaways from the data learning series and how she plans to put those into practice going forward. Let's take a look at the video. Elizabeth, thanks so much for joining us today for this workshop. Just to get us started, can you begin by introducing yourself and telling us a little bit about the Parenting Path?
Sure. Hi, everybody. I'm Elizabeth Miller. I'm the CEO at the Parenting Path. We are a child abuse prevention agency in Forsyth County. We actually serve 11 counties in Northwest North Carolina. We have 14 different programs and services that we offer. And really, we work to focus on family and child health along the entire continuum. We want to make sure that families feel like they're being supported, that we're really strengthening the relationships that parents and children have with each other, and then also helping make sure that families learn more about child development and get linked up to community resources that they may need.
Wonderful, thank you. And Elizabeth, as one of the participants for the Dismantling Racism with Data Learning series, can you tell us a little bit about your top 2 takeaways from the webinars? And how do those lessons continue to show up in your work today?
No, I think the biggest takeaway that we had was how other folks are utilizing data. I think you have a very good idea how you are doing it, but it's nice to see what other people are doing. And I think a lot of times in the work that we do, particularly in nonprofits, we tend to be siloed. In some ways, I think grant funders force us to be that way because there's a lot of competition for funding and people don't want to share what they're doing. But I think it was really helpful for us to just be able to examine how other agencies were using data. It gave us a really good benchmark for us because I think in some ways we were afraid that we were sort of at the back of the pack in terms of using data. And it allowed us to see that we actually weren't, that we were doing some advanced things with data, which was helpful to us. And I think also was encouraging us to continue to pursue looking at different ways to use that data. Because I think sometimes when you think that you're behind everyone else, you get discouraged and you don't want to look at it anymore. And when you realize that actually you're doing some things that other people haven't thought of, it was good to be able to see that. And I think the other thing that we really took away from that was just the many different ways we can use data, because I think for us, a lot of times we're so focused on data reporting for grants and for funders that's sort of what takes the priority in your mind, that's what you think about first, and that there are ways to look at using that data that have absolutely nothing to do with what you're doing with funders or with grants.
Wonderful. Thank you so much, Elizabeth. And I'm glad to hear that, those were 2 things that really stuck with your team as a result of the webinars. Elizabeth, as you know, the Parenting Path was one of 3 agencies who received detailed technical assistance as part of the learning series. You all worked with a consultant to talk about, as you were noting, some of the different ways that you can use data at the Parenting Path. So I'm wondering if you can tell the audience a little bit about what work you did with the consultant.
Sure. One of the things that Joetta Shepard, who's our Chief Operating Officer, and I have really had as a long-term goal for the agency is to do an annual report. That's not something that we've done yet as an agency. And I think initially we were really looking at it as a way to showcase to donors and then to other agencies in the community the work that we did. And I think we probably would have included disaggregated data in that. But when we started looking at it with the consultant, what we realized is the people that we really wanted to see the work that we did and to focus on getting the annual report to would be the folks that receive services and the folks that seek services from our agency. And I think we saw both the annual report and the data as a way to reassure them that we're looking at respecting culture, at working with families from a strengths-based perspective, and really putting families in the driver's seat as far as their goals and what they'd like to achieve by working through our agency. And I think that to us was really sort of a light bulb moment, because before we had been thinking about annual reports in the way that most folks use annual reports to drive donations, to potentially attract attention from funders. And we recognized that that's not what we wanted to do, that we already have enough in place to do that. And we think that we have a special place of trust in the community. We get a lot of families that are willing to engage with our agency that aren't willing to work with other agencies. And I think one of the ways that we do that is really some of those important things in terms of respecting culture, having a diverse staff, looking at strengths over everything else. And I think we wanted to be able to show that to people through that reporting. And there's always, right, my dad says when you pitch something, you have to do the qualitative part, you have to tug on people's heartstrings, but then there's also the quantitative piece, and you have to show people things through numbers. It's not enough just to say that you did it. And I think we saw that annual report as a way to show those people in the community who've placed their trust and faith in us that it's not just something that we're saying, that we're actually doing those things in the community.
Love that. Thank you, Elizabeth. So it sounds like you all really found a way to use data as a way to strengthen that trust with community and to promote transparency in the work that you all are doing, which are super important. And, you know, I'm excited to hear about how that continues to strengthen the work that you all do. So thank you for sharing. As you know, it can take a lot of time to do consensus building work with our staff or external stakeholders. You mentioned funders to get on board with talking about and using data that's disaggregated by race and ethnicity. What have you found as you've explored this work to be helpful in that process of bringing others into this work?
So I think one of the things that our consultant really helped us identify is that we have allies in the community that we may not have considered before in terms of bringing them into this work. We do a tremendous amount of work for one of the law enforcement agencies in the community. We have a very strong partnership with our local Department of Social Services. And I think always before that we've thought that we couldn't use some of their voices because they can't be seen to be prioritizing us in terms of funding. They have to be neutral parties. But that there were ways for them to talk about the work we did with families that we wouldn't be using to try and raise money that could really show the strength of that partnership and to help folks understand how we work hand in hand with some of those agencies.
That's wonderful. Thank you for that. Great example. And Elizabeth, is there anything else that you'd like to share, any advice you'd like to give to folks who are listening into this workshop who are interested in taking that next step with data in their work?
Yeah. So I think it's very important to think about the how and the why that you might potentially be looking at using the disaggregated data. I think sometimes we, especially as the people who are looking at the bottom line, always have dollars and cents in mind, and how is this going to change my bottom line? And that can't be the focus with this. One of the things that we have been very intentional about as an agency with our board and with our staff is making sure that we have both a diverse staff and a diverse board that represent our community. In our leadership team, we have 5 people on the leadership team. I'm proud to say that 3 of them are people of color. 1 of them is LGBTQIA. On our staff, we have a wide range of people, incredibly diverse from all different backgrounds. on our board, we have former service recipients. And I think before you start looking at trying to disaggregate data, you also need to look at how is that data showing up on your staff and on your board, and how does that impact the work that you do? Because I can't personally put myself in the same shoes as someone who's a minority and know how that feels to them. And so how do we incorporate those voices into our leadership? And for those of us who are white, that means taking a step back and listening and thinking about what those data points mean and how do we market them as a positive? Because what we never want to do is say that of the people that we serve, 37% of them are Black, and then let that be translated into, well, Black people need more help than white people, because there's obviously some considerable bias in terms of reporting to social services, in terms of people being identified as being required to accept services. And I think we always want to look at how that data could harm as well as how that data could help, and to be very intentional about recognizing that there are ways data can harm, and to really commit ourselves to not participating in any processes where we're using data in a way that could harm people.
Those are some great points, Elizabeth. And, you really touched on something really important of how we think about, as we approach data work and do it, is not perpetuating racial biases by repeating, kind of those negative talking points about communities of color. And so I think that's really important for folks to keep in mind, as well as you touched on, as you do kind of that internal data gathering and think about what are the questions we're trying to gather. If you're doing any data collection from the community or thinking about how you might present the data, making sure you've got an inclusive and diverse group of voices in the room to make those decisions. I think that's really important as well. So I appreciate you pointing that out and encouraging folks to start there. And just thank you so much for your time and sharing with us kind of what you all learned as you engaged in this learning series. And I appreciate you all and the work that you do. So thank you, Elizabeth.
No, thank you for having us.
Thank you. I hope that our time today inspired you to dig into data, both the numbers and the stories, and that you feel empowered to use data as a tool for effective advocacy to drive change. Now we'll take your questions in a live Q&A. Thank you.
Thank you so much. And please do take a moment to ask any questions you have in the Q&A. I know that there is a question for contact information already, and we will make sure we throw that into the chat as well. So I can get us kicked off with some questions that I have for both you, Elizabeth and Vikki. And it's a little bit coming off of what we were just hearing in the presentation around the need to really be thoughtful about how we're using this data and how we are interpreting it and promoting it with other folks. But I almost want us to take a quick step back, because I think from what I saw, people sounding off in the chat earlier, that there's a lot of use of data for internal work at organizations. But we also were talking about the need to have access for communities to have access to the data that's about them. And I'd love to hear more about strategies and ways you think that folks can access this information, where they can find it, and then how they can start to incorporate it into their local advocacy efforts.
Thanks, Kaylin, and thank you all so much for joining us this morning and for participating with us in the chat. I can take a first stab at the question, and Elizabeth, feel free to jump in. Elizabeth, as the CEO of the Parenting Path, as she shared in her interview, they work with a lot of data from the services that they offer. And so sometimes it's a question of how can we share that data in a way that is equitable and doesn't perpetuate stereotypes. And also, another thing that's important for folks to think about is how do we protect those communities as well? Because that's the two-sided coin about disaggregated data. Is on the one hand, we're helping to outline the scope of a problem so that we can identify the solutions. On the other hand, especially when we're talking about local data, we have to be careful to protect the anonymity of our communities of color, particularly in smaller communities. And so, but there are ways that organizations can do that. And I'm happy to share resources for, good practices for sharing data that's disaggregated in a way that is protective of communities. And I just think the big takeaway is if you're sharing disaggregated data, to provide context and to think about how you can use asset framing as you share that data.
And I think, Vikki, this was really brought home to me last week because we were on a meeting and one of the other folks on the meeting was a statewide provider of services, and we're more regionalized and most of our services are in Forsyth County. And we've been working on a data sharing project with some of the agencies that are part of this consortium. And as the data popped up, the other person on the call went, "Oh my gosh, what has happened in 27105, which is the zip code where our agency is located?" And it was interesting to watch the faces of the people who were from Forsyth County and then their response to that question, because immediately we knew that's East Winston-Salem proper. That's where our office is. That is a place where for a long time, the city of Winston-Salem has not invested resources, where we have had segregated housing, where even things just like the roads don't get the attention that they should. And so to me, that was so powerful, because if you are looking at it from a 10,000 foot view, you would go, "Ooh, there's something wrong in 27105. And they're right, there is something wrong, but it is how we have systemically and historically oppressed, underserved, segregated those populations. And that doesn't have anything to do with maybe how they grew up, how they're responding to those things, and has so much to do with how we as a community have responded to those folks. And it was one of those light bulb moments for me, because I've never thought of it when we look at data, because when we are looking at things by zip code, I know where those places are in our community. But I think sometimes when you aren't looking at those factors, sort of to your point during your presentation, if you don't have the whole story, you can tell a different story with the data. And we need to look at what are the groundwater things there that have contributed to that data, rather than, what is wrong in 27105.
Thank you so much. And we have another question that just came in the chat. Thank you so much, Rochelle. So they ask, what are some ways you can help ensure or encourage data ownership and accountability, especially with disaggregated data, both in kind of an internal staff organizational capacity, as well as externally with decision makers and policymakers?
Yeah, thank you for the question. And I'm trying to understand kind of what you mean by data ownership as I think about how to respond to that question with data disaggregated.
Vikki,
yeah, go ahead, Elizabeth.
Maybe, and I may be off base, but my best social workers who make amazing connections with families and who really help families see their own strengths are not always the ones who are great about making sure every box is checked on our agency data. And what we've learned as sort of a process there is that we've made that the external responsibility of some folks who are good with data. And we recognize maybe that's not always everybody's gift, but that we're working on identifying point people who kind of, in slang terms, geek out on the data, and that's exciting to them. And so if things are missing, they're trying to work with those other staff members to make sure that they're filled in, because my best folks who really make those strong connections with families, if they're not remembering to check all the boxes, that's not necessarily where their strengths and gifts are. And I don't think I need to force them to do that. We'd rather figure out maybe different solutions. Am I way off base in terms of your question?
Well, go ahead, Vikki.
No, I was just going to say, yeah, it looks like in the chat, that was exactly what they were referring to. And as you shared your response, Elizabeth, that clicked for me. So yeah, absolutely. I think that is a challenge, a lot of times with agencies, particularly at the local level, is like, how do we start good data collection processes that can ensure accurate data? And I definitely agree that while I know funding can always be a challenge, this is one place where you definitely want to carve out investments at your agency to ensure good, clean data, and to have folks who have experience kind of documenting these things to make sure that that data is reliable. And there are resources as well. If funding is a barrier, there are certainly resources that, you know, we can share about how we can practice good data collection and cleaning.
And the other thing I would say externally is if your county has some sort of data office, I would meet with them to see what capacity they have for services, because we have a data sharing project that we're doing right now where we're involving 3 agencies and we're all doing some collective data, and our county data office is the one who's helping to do the analysis, but then also letting us know, hey, I've looked at this other agency's data and this is what you guys are missing, and we need you to start collecting this as well. And sometimes that's easier to take that from a neutral source rather than another agency pointing out that you're missing something.
That's such a good point. For folks who are here with us this morning who might not know, how do you find out your local kind of county and data folks that you can get this information from?
If you're in a larger county, there's usually like a standalone data office. And Forsyth County, ours is called MAP Forsyth, MAP Forsyth. I would suspect in smaller counties, that's probably part of someone else's responsibility. But I would start off by talking to your county manager or your assistant county manager, or if you know somebody on your county commissioners, they can tell you, because no matter the size of the county, there's data that they've got to collect for state things. So there was someone at your county that has a data responsibility. And for the most part, we found that they're delightful and they want to figure out how to help us use data.
Yeah.
Oh, Vikki, yeah, no, you're right. The kids count data profiles are amazing. Every time I write a grant, I am pulling up the kids count data cards. So let me give you guys a shout out on the conference for that, because even when we are talking with funders or doing fundraising, like we will take that card and be like, look at how we benchmark with the rest of the state. You know, here are some of the reasons why, and here are some of the things that we can do to improve that outcome.
Absolutely. Yes. Thank you, Elizabeth. Particularly for folks who work with children and families, the Kids Count data profile is a good place, the county data cards. And one thing that we launched last year for the first time was an interactive data dashboard for county data that disaggregated for the first time, disaggregated data by race and ethnicity. So again, we can start to see those differences across racial and ethnic groups and be able to identify, you know, what are the needs within communities.
Thank you so much. I think, yes, kids count. I'm glad, Elizabeth, I'm not the only one that every time I have a grant going on, I have one window exclusively for my kids count data. I do want to go back a little bit to a question we just answered around oversight and kind of ownership and accountability, but think about it from the perspective of that quantitative data piece. You mapped out so well in the presentation the need for both this qualitative, hard numbers, but that it's incomplete unless it's presented in the full context of experience. And that qualitative data, what people are bringing, excuse me, to this, to that experience. And so, you know, I'd love to hear how you both have kind of navigated that, because those are people's stories, those are people's experience, and they also happen to contribute to data. But that is a fine line to walk. So I'd love to hear how you've both explored and navigated that.
And so just to make sure I'm understanding the question, Kaylin, you're asking about qualitative data and those stories and how we can do that in a way that's equitable?
Yes, and how you, and thank you, sorry, my first cup of coffee is clearly not kicked in.
No, you're good.
And not only the equitable piece, but also how you navigate kind of the ownership of that, who is using those stories, who is able to manipulate that data and how, and what sort of practices you've put into place to prevent kind of maluse of that.
Mm-hmm. There's some really great data template, data user template agreements out there that we actually just started using at NC Child. But certainly, whether it's quantitative data or qualitative data, like someone that has been willing to be vulnerable and share their story with you, always asking first, what are the parameters for how we use this data, and being clear with them from the get-go how you'd like to use that data, right? If it's a story that they're willing to share, where are we putting that? It's helpful to put an end date on it oftentimes, so that it doesn't kind of open itself up to be used in a way that's exploitative, right? Say we would want to keep this data for 6 months or a month. And then if you want to use that data after that period, come back to that person or that agency and ask for permission again. And then, just I think being really clear in communication is helpful. Does that kind of get at what you were asking, Kaylin?
And I think to Vicki's right, being so intentional, but also, and this may be the wrong answer after I've talked about data sharing and working with other agencies, but being really protective of the qualitative data that we allow to go out into the community. For a lot of our grant funders, we have to tell them a success story when we're reporting back on the funding that they've given us. And a lot of times they ask, are we able to share this story? And a lot of times my answer is no, because I don't necessarily always have the confidence that it's going to be treated in the way that it should be. It's similar to every year at Christmas, we will always have one of the news agencies want to come and see us deliver presents to a family. And my staff will tell you, like, we are really protective of our families because they are not a news piece for us to show, oh, look at these poor people that we have done X, Y, and Z for. And I know that we could get a lot more donations and probably a lot more support for that process if we did that. But I think, to me, that's using data in an inappropriate way, because we are demonstrating, like, look at these poor people that we have fixed, rather than look at this family who is voluntarily engaging with services with us to promote the strengths of their family.
That's such an incredible point and really important to lift up, because I feel like, as both kind of funders and state departments and other players who are often in positions of power are moving into these spaces of wanting to engage community, they're doing it through that lens of, tell me what you've gone and fixed, tell me how you have disrupted or changed issues. And that really does require, I think, the folks presenting the data to be so thoughtful about how they are sharing that, so that we're not creating these false narratives that people are just standing around twiddling their thumbs waiting to be rescued, and that it's the job of advocates to do so, and that there's so much strength coming from the communities themselves. So I'm really glad you lifted that up. So we have talked a lot about how we would share data, how we protect our data, how important it is to couple it within context. But as Vikki well knows, one of my soapboxes is that a lot of the systems, I should say, we engage in are publicly funded. But our data around those systems is mysteriously gone or very difficult to access. So, and I think that's wholly wrong, because if they're public, we should get it all. But I digress on that front to ask the question of what data, just so folks know, in case they're not, totally ingrained in this work, is kind of readily available, and from what sources that's useful for community. And my follow-up question, but I can ask it again later, is what do we need? What are the data sources we are missing, and how should we go about advocating for those? So source number one is really just, where do people find this information? I know we mentioned kids count. Sorry, I got to plug in my computer. And we have other kind of federal and state sources, but I think it would be helpful to walk folks through kind of where you find your information.
Yeah, gosh, that's such a big question, Kaylin. There's so many great sources out there. A lot of national organizations are doing some really great data work. For example, some of you all might not know, but the Census Bureau was collecting and continues to collect weekly data on how families are doing during the pandemic. It's called the Household Pulse Survey. So we have real-time data about how families are faring. And that data is really just giant spreadsheets. Like you can find it at the state level, but like you have to dig and whatnot and have to analyze it. So there are organizations like the Center on Budget, Georgetown, the Kaiser Family Foundation, who are pulling all of this data and making it into tools that we can use more readily, like infographics or interactive map that we can go and see like how families are doing, and not just related to the pandemic, but on all sorts of fronts like health. There's some really great resources that are slipping my mind at the moment on that bring together a set of data around what we refer to as the social determinants of health, right? So that we're not just thinking about a problem from one perspective, but we're also thinking about the environment that families are in. What are some of the other factors in a community that affect health and affect well-being? The Early Childhood Foundation has really great data as well. The state Early Childhood Action Plan. Through that plan, they have done a lot of data collection. And so these are things that, you can Google. Kaylin shared a link in the chat, but you should be able to find some really great, data resources through that way. Elizabeth, do any come to mind for you?
If I'm coordinated enough, I'm going to put some in the chat. So we do a lot of work around child maltreatment and the number of kids in foster care, and UNC actually hosts a great data set where you can look at point in time in terms of how many children are in the system, how many children have been reported. They actually disaggregate that data as well. So you can look at it by race, you can get by ethnicity, you can look at it by geographical location. And then there is also the North Carolina multiple response system, which is a little clunkier to navigate. But I think, when we're starting to look at how do we look at systems in the inappropriate ways that, we may be not responding correctly to data, if we want to look at, why are certain people overrepresented in a system, that may be a good place to look and research as well. And I think I sent them to the chat, but I don't guarantee it because technology.
You did, and you did so great. Thank you. We have 3 more minutes. It looks like there is one question. Oh, resources and assistance. Maybe we can follow up with you, Alicia, offline so that we can get a better sense of what kind of resources we can provide. So my last follow-up, my call to arms is, what's missing? What do we need to be advocating for? And who do we need to be talking to so we can get more data that is usable by communities and that really supports our advocacy efforts?
Yeah, that's a great question, Kaylin. In almost every area of health and well-being, there is data that is missing. And often it's that local county level data or data disaggregated by race and ethnicity that is really important for us to know. One of the things that we come up on every year is the county data cards, and food insecurity is one of those areas where there is a lack of data. We have good data on people who use the SNAP program, so the food assistance program. Those are very low-income families. But we don't have good disaggregated data about families in general who experience food insecurity in North Carolina at the local level. So that's one that comes to mind for me. Elizabeth, what do you think about?
So the longer I've done this job, the more I've recognized that we get really heated every 4 years about our presidential elections, but that we don't spend a lot of time thinking about our local and state leaders. And to be honest, the outcomes for kids at the local level are so much better when you have local officials who are interested in this, who are well-versed in the data, who understand what the challenges are. And our county commissioners have more control over our day-to-day lives than the president does, honestly. And I think we don't spend a lot of time looking at that. We complain a lot about national policies or state policies, and there are lots of things that, yes, could be helped there, but we've got to make that investment to educating our local officials about what this data means. and not just sort of focusing on the giant picture.
Sure, yeah. And asking them to invest in data collection.
Yep. And making it easily accessible and transparent and readable to people who don't have PhDs, and even people who do. I so appreciate this entire conversation this morning. Thank you so much, Vikki and Elizabeth, for all of your incredible expertise and insight and walking us through some of these questions. And thank you to everyone who joined us this morning for jumping on. First thing on a Wednesday to talk about data. I commend y'all just for that. So we will be following up, of course, with our recording when those are available. And you see Elizabeth and Vikki have added their contact information into the chat, so you can follow up with any other questions. Thank you again so much, and hope you enjoyed the rest of 2022 Kids today.
Thank you guys so much. This was really a special thing to be a part of.